What if I told you there is a compound that could potentially help you lose stubborn fat, build lean muscle, improve recovery, and slow down aging? And no, I'm not talking about some miracle pill being sold on a late night infomercial. Hi guys, I am Jay Patel. I'm a certified PA specializing in hormones, weight loss and AGH peptides. And today we are diving deep into Ipamorelin, one of the most promising peptide in the world of performance enhancement and anti-aging medicine. Imagine waking up feeling like you have turned back the clock 10 years. Your recovery between your workout is faster. The stubborn belly fat is finally responding to your efforts. Your skin has a glow that people are noticing, and you are sleeping better than you have in years. If you are struggling with any of these issues, poor recovery, stubborn fat, signs of aging, or decreased performance, this video might change your life. As a medical professional who specializes in performance optimization, I have seen firsthand how peptides like Ipamorelin are transforming my patients' health journeys. But here's the thing, this isn't some magic bullet. Ipamorelin works differently than anything you have probably tried before, and that's exactly what we are breaking down today. Here is what you will learn today. What exactly Ipamorelin is in a simple term, how it works in your body to produce results, the science-backed benefit for anti-aging, performance and weight loss, how to use it safely and effectively, powerful peptide combination for enhanced results, and who should and who shouldn't consider peptide therapy. So stay tuned. Whether you are an athlete looking for that edge, someone fighting the aging process, or just trying to optimize your health, you need to understand how peptides like Ipamorelin are revolutionizing the way we approach human performance and longevity. So if you're ready to understand one of the medicine's most exciting frontier, let's dive in. So what exactly is Ipamorelin? Let's break it down in a simple terms. Ipamorelin is what we call the growth hormone secretagogue peptide. Now I know that's a mouthful, but stay with me. It's simpler than it sounds. A peptide is essentially a small protein made up of amino acids, the building blocks of life. Ipamorelin is a synthetic pentapeptide, meaning it contains 5 amino acids linked together in a very specific sequence. Unlike steroids or synthetic hormones that induces foreign substance into your body, Ipamorelin works by stimulating your body's natural processes. Specifically, Ipamorelin signals your pituitary gland to increase production of your body's own growth hormone. It's like turning up the volume on the system that naturally exists in your body but may have been tuned down as you aged. What makes Ipamorelin special compared to other peptides is its high level of specificity. It selectively targets growth hormone release without affecting other hormones like cortisol or prolactin. This selective action is why many medical professionals, myself included, often consider it one of the cleanest peptides available. It delivers the benefit of increased growth hormone without many of the side effects associated with less selective compounds. Think of it this way. If your body's growth hormone production is like a dimmer switch that has been turned down with age, Ipamorelin doesn't replace the light bulb with something artificial. It simply helps turn that dimmer back up towards where it was in your youth. So the science of Ipamorelin. Now let's get into the fascinating science of how Ipamorelin actually works in your body. I promise to keep this straightforward even though the mechanisms are complex. So when Ipamorelin enters your bloodstream, it travels to your brain and binds to a specific receptor called growth hormone secretagogue receptors located in your pituitary gland. This binding activates a cascade of biochemical events that signals your pituitary to release pulses of growth hormone, mimicking the natural pulsatile release pattern your body used to have when you were younger. This is crucial because growth hormone doesn't work well when released in a constant stream. Your body is designed to respond to these natural pulses. As we age, these natural pulses of growth hormone diminish significantly, by as much as 50% every 7 years after the age of 30 for many people. This decline correlates directly with many of the symptoms we associate with aging. What's remarkable about Ipamorelin is that it doesn't just forces your body to produce more growth hormone regardless of circumstances. Instead, it helps restore a more youthful pattern of release. Once released, growth hormone travels throughout your body where it either acts directly onto the tissue or more commonly stimulates the production of insulin like growth factor 1 in the liver. Together, this compound influences virtually every cell and system in your body. They signal your body to build and repair muscle tissue, mobilize fat storage for energy, regenerate cell into organs, skin and bones, optimize immune function, enhance recovery and healing. And contrary to what some may fear, the modest increase in growth hormone from Ipamorelin doesn't cause uncontrolled growth or cancer promotion. It's designed to restore more youthful level, not create supraphysiological state. This is the fundamental difference between therapeutic peptide use and hormone abuse. We are supporting natural processes, not overwhelming them. So the anti-aging benefits now. Now let's talk about what most people are excited about. How Ipamorelin can potentially slow down or even reverse certain aspects of aging. I want to be clear that Ipamorelin isn't the fountain of youth in a bottle. Nothing is. But the research and clinical experience suggest it can address several key mechanisms of aging. First, let's talk about your skin. The growth hormone stimulates collagen production, the protein that gives your skin its structure and elasticity. As we age, collagen production declines dramatically, leading to wrinkle and sagging. Many of my patients report noticeable improvement in skin elasticity, thickness, and hydration after several months of Ipamorelin therapy. Some describe it as having their skin plump up from inside out. Second, Ipamorelin helps combat what we call sarcopenic obesity, the frustrating combination of muscle loss and fat gain that happens as we age. By enhancing protein synthesis and fat mobilization, it helps preserve lean muscle while reducing adipose tissue, especially around the midsection. This doesn't just make you look better, it fundamentally improves your metabolic health and reduces inflammation, two key drivers of the biological aging. Third, and this is something my patients often notice first, Ipamorelin can significantly improve sleep quality. Growth hormone is primarily released during the deep sleep, and this relationship works both ways. Ipamorelin helps strengthen your sleep architecture, particularly those crucial deep sleep phases where most cellular repairs happen. Better sleep means better recovery, improved cognitive function, and enhanced mood, all of which makes you both feel and function younger. And finally, Ipamorelin may help maintain bone mineral density, a critical factor in aging. Growth hormone is necessary for bone remodeling and mineralization. Many aging adults, especially women, facing declined bone density, which can lead to fractures and loss of independence. By supporting your body's natural bone maintenance system, Ipamorelin may help you maintain the strong skeletal framework needed for an active lifestyle as you age. What's important to understand is that this benefit works synergetically. Better sleep leads to better recovery, which supports better workout, which builds more muscle, which improves metabolic health, and so on. It's the positive cascade effect, so the performance enhancement. Let's talk about how Ipamorelin can potentially enhance physical performance. Whether you are an athlete or just someone who wants to get more out of your workouts. One of the most consistent benefits my patient reports is significantly improved recovery between training sessions. This makes perfect sense when you understand the growth hormone's role in tissue repair. So when you exercise intensely, you create a microscopic damage to the muscle fibers. This damage needs to be repaired before those muscles can perform optimally again. Growth hormone accelerates this repair process by increasing protein synthesis and cell regeneration. What does this mean practically? It means you may be able to train more frequently at higher intensity without overtraining. It means less soreness and stiffness between sessions. It means a faster return to the peak performance. Many users also report enhanced work capacity during their training. This likely stems from the growth hormone's ability to increase glucose and fatty acid availability for energy production, essentially giving your cell more fuel to work with. Growth hormone is also known to increase tendon strength and flexibility, crucial factor for injury prevention. As any athlete knows, staying injury-free is often the determining factor in long-term progress. Perhaps most visibly, Ipamorelin supports muscle hypertrophy, the growth of the muscle tissue. To be clear, it's not anabolic in the way testosterone or synthetic steroids are. Rather, it enhances the anabolic environment, making your body more responsive to training stimulus. This means you'll still need to put in work, but you may see better results from that work. particularly as you age and your natural anabolic process declines. For endurance athletes, Ipamorelin's effect on mitochondrial function and oxygen carrying capacity can translate to improved aerobic performance and sustained energy level. I want to emphasize that Ipamorelin is not currently banned by most major sport organizations. However, professional athletes should always check their specific governing body's regulation, as this can change. The performance benefits of Ipamorelin tend to be more subtle and cumulative than dramatic and immediate. This isn't about superhuman performance. It's about optimizing your body's natural recovery and adaptation processes. So the weight loss benefits of Ipamorelin now. Now let's address one of the most common reasons people become interested in Ipamorelin. Its potential to support healthy weight management, practically fat loss. Growth hormone is a powerful lipolytic agent, meaning it helps break down fat stores and mobilize them for energy. This process, called lipolysis, is essential for reducing body fat percentage. Specifically, growth hormone stimulates the release of fatty acid from adipose tissue, particularly from visceral fat, the dangerous kind that accumulate around your organ and contributes to the metabolic dysfunction. These freed fatty acids then become available as a fuel for your muscle and organ, essentially allowing your body to more efficiently burn stored fat for energy. So what makes Ipamorelin particularly more effective for many people is that it enhances this fat burning process without stimulating appetite the way many weight loss medications do. In fact, by optimizing other hormones, it may help regulate hunger signals. In my clinic, we frequently use body scan to track body composition changes, and we typically see improvement in the lean to fat ratio within 2 to 3 months of consistent Ipamorelin use combined with appropriate nutrition and strength training. But here's what I want to emphasize. Ipamorelin isn't a quick fix or miracle weight loss solution. It works best as part of the comprehensive approach that includes a nutritional plan appropriate for your goals, regular physical activity including resistance training, adequate sleep and stress management, and proper hydration. Think of Ipamorelin as removing a roadblock that may have been preventing your body from responding optimally to these health behaviors. Another important factor is that by preserving or increasing a lean muscle mass while losing fat, Ipamorelin helps protect your metabolic rate. This addresses one of the biggest challenges in the weight management, the metabolic slowdown that typically occurs with weight loss. For many of my patients, especially those over 40, this combination of enhanced fat metabolism and preserved metabolic rate makes Ipamorelin a valuable tool in their weight management toolkit. So the dosage and administration now. So let's talk about how Ipamorelin is typically administered, dosed, and what protocol tend to work best on a clinical experience. First, it is important to understand that Ipamorelin is typically administered as sub-Q injection, meaning into the fatty tissue just under the skin, similar to how diabetics inject insulin. Common injection sites includes the abdomen, avoiding the navel area, the front of the thigh, or back of your upper arm. The technique is simple. Pinch an inch of the skin, insert a small needle at the angle about 45-degree angle, and slowly inject the solution. For those concerned about needles, the good news is that these are very small insulin needles that causes minimal discomfort. Most patients find the process much easier than they expected. As for dosage, this should always be determined by a qualified healthcare provider based on your individual needs, goals, and medical history. However, typical therapeutic range for Ipamorelin are between 200 to 300 micrograms per dose. Ipamorelin is typically administered in multiple ways. Some people inject 1 to 3 times daily, with one of those doses ideally taken before bedtime to amplify the natural nighttime pulses of growth hormone. I recommend a 5-day on, 2-day off schedule to prevent receptor downregulation and maintain the sensitivity to the peptide over time, and I usually only recommend one time at night. Now, some important considerations. Ipamorelin should be taken on an empty stomach, ideally 2 to 3 hours after eating. So it's best to take it at night right before you go to bed. Avoid eating for at least 30 minutes after injection for optimal absorption. Store reconstituted Ipamorelin in the refrigerator. Visible particles or cloudiness in the solution indicate it should not be used. The duration of therapy varies by individual and goals, but many therapeutic protocol ranges from 3 to 6 months, followed by a break to assess the result and allow the body's natural system to recalibrate. It's worth noting that results are not immediate. Most patients begin noticing subjective improvement in sleep and recovery within 2 to 4 weeks, with more visible changes in body composition typically requiring 2 to 3 months of a constant use. So monitoring is an important part of any peptide therapy. At a minimal, I recommend baseline and follow-up IGF-1 level, comprehensive metabolic panel, and body composition analysis to objectively track your response. Finally, I cannot stress enough that Ipamorelin, like all other peptides, should be obtained through a legitimate medical channels. Quality and purity are paramount for both safety and efficacy. Now, the synergetic peptide combinations with Ipamorelin. Now let's talk about something that can take your results to the next level. Combining Ipamorelin with complementary peptide for enhanced effects. In clinical practice, Ipamorelin is rarely used alone. Instead, it's often combined with other peptides that work synergetically to amplify the growth hormone release and overall effects. The most common and the well-researched combination is Ipamorelin with CJC1295. While Ipamorelin provides a clean pulse of growth hormone release, CJC1295 extends and amplifies that pulse. Think of it this way: Ipamorelin opens the door for growth hormone release while CJC1295 keeps that door open longer. Together, they create a more substantial and sustained release than each alone. These combinations typically lead to higher peak level of growth hormone and longer duration of elevation, potentially enhancing all the benefits we have discussed today. Another popular combination is Ipamorelin with Samorelin. Samorelin is one of the oldest growth hormone secretagogues and works through the slightly different mechanism than Ipamorelin. By activating different receptors and pathways, this combination can provide more comprehensive stimulation of your body's growth hormone system. For those of you specifically focused on reducing visceral fat, particularly around the abdominal area, the addition of Tesamorelin to an Ipamorelin protocol can be very effective. Tesamorelin has been FDA approved for reducing excess abdominal fat in certain medical conditions. For enhanced recovery, for muscle building and performance effect, incorporate BPC 157 or TB500. These two peptides that specifically target tissue healing and repair. When combining peptides, dosage typically needs adjustment. For example, when combining Ipamorelin with CJC1295, each compound is often dosed at about 100 to 200 micrograms for a total injection of 200 to 400 micrograms. It's worth noting that more complex combinations require even more careful medical supervision. Each additional peptide introduces new variable and potential interactions. Based on my clinical experience, I find that the most patients achieve excellent results with the simple Ipamorelin CJC1295 combination before considering more advanced protocol. Now, potential side effects and contraindications. So before considering any peptide therapy, it is critical to understand potential side effects and situations where these compounds might not be appropriate. The good news is that Ipamorelin has one of the cleanest side effect profile amongst all the peptides, largely due to its selective action on growth hormone without affecting other hormones. So common side effects may include temporary water retention, particularly at the beginning of therapy, temporary tingling or numbness at the injection site, headache in some individuals, often relating to change in blood glucose, joint pain or stiffness as tissue regenerate, and increased vivid dreams due to enhanced deep sleep. Most of these effects are mild and transient, typically resolving within the first few weeks of treatment as your body adjusts. However, Ipamorelin is not appropriate for everyone. So who cannot take Ipamorelin? Contraindications include active cancer or history of certain cancer. Growth hormone can potentially accelerate existing cancer growth. Uncontrolled diabetes due to the growth hormone's effect on insulin sensitivity. Severe cardiovascular disease, pregnancy or breastfeeding, an individual under the age of 18 whose growth plate haven't closed yet. Additionally, Ipamorelin may interact with medications that affect growth hormone or blood sugar, such as insulin, oral diabetic medications, or corticosteroids. This is why proper medical screening before starting therapy is absolutely essential. A qualified provider will review your medical history, current medication, and may order a specific lab to ensure Ipamorelin is safe for you. Even after knowing all the benefits, make sure you start the treatment under the medical supervision. I want to emphasize that while peptides like Ipamorelin has tremendous therapeutic potential, they are powerful biological compounds that deserve respect. Self-administration without proper guidance increases the risk of side effect and reduces the likelihood of achieving your desired outcome. Like I said, make sure you follow up with your medical provider and do not start before getting a full medical examination from a qualified medical provider. So we have covered a lot of ground on Ipamorelin today, from its mechanism and benefits to practical aspect of administration and potential combinations. To summarize what we have learned, Ipamorelin is a selective growth hormone secretagogue that stimulates your body's natural growth hormone production. It offers potential benefit for anti-aging, performance enhancement, and weight management. When combined with other peptides like CJC1295, these effects can be significantly amplified. Like any medical therapy, it requires proper screening, administration, and monitoring. What fascinates me most about peptides like Ipamorelin is that they represent a fundamentally different approach to the health optimization, working with your body's natural processes rather than overriding them. In my practice, I have seen remarkable transformation, not just in a physical appearance but in a quality of life. Patients sleeping better, recovering faster, performing at the level they thought were behind them, and feeling more vibrant and energetic. These compounds are not miracle cures or quick fixes. They work best as a part of a comprehensive approach to health that includes proper nutrition, regular exercise, stress management, and adequate sleep. If you are interested in learning whether the peptide therapy might be appropriate for you, I encourage you to consult with a qualified healthcare provider who specializes in peptide therapy and performance medicine. Get appropriate baseline testing done to establish your starting point. Develop a comprehensive plan that includes lifestyle optimization along with any peptide protocol. Commit to consistent implementation and regular monitoring, and combine this with overall lifestyle improvement, and you will see the results that you never imagined. If you found this information valuable, please support the channel by liking this video, subscribing, and hitting that notification bell to stay updated on a future content about optimizing strategy and cutting-edge therapies. In the comment below, let me know what other peptides or performance topic you would like me to cover in future videos. Your question helps shapes the content I create. This is Jay Patel from MyFitMed. I'm dedicated to helping you optimize your performance, extend your health span, and live your most vital life. Thank you for watching, and I'll see you in the next video.